and interacting with every other conceivable specialty. On any given day, any page of the physiology, pathology, or pharmacy texts may need to be scoured for a reference. From the time we meet in the pre-anesthesia area until the point that, after the procedure is over, I'm assured my patient has returned to a state of comfort and is prepared to reunite with loved ones, I am the primary care physician. During my anesthesia care, I become the internist, the OBGYN, the pediatrician. The child scheduled to have a skin mole removed might have a failing heart. The woman whose brain aneurysm has burst might also suffer the pain and deformities of rheumatoid arthritis. When things take a turn for the worse during a procedure, when the blood loss climbs or the heart rhythm goes awry, it's left to the anesthesiologist to make life right. Over 170 years ago, inhaling a gas was shown to render a person senseless and thereby allow invasive medical procedures. Healthcare exploded. The magnitude of this medical discovery remains obvious today. The number of patients receiving anesthesia grows every year. The renowned New England Journal of Medicine recently polled its readers to select the most important article the magazine had published in its distinguished history. The resounding favorite its readers settled on was the NEJM's 1846 article by Henry Jacob Bigelow about the demonstration showing that inhaling ether allows for pain-free surgery. Anesthesia as a term had not yet been coined. This article, published just a few months after the historic demonstration at Mass General's Ether Dome in Boston, bested every advance made since then, including the introduction of antisepsis, of X-ray imaging, and of antibiotics. More than a century and a half later, I am unable to provide an answer when patients and families ask the most basic question of my specialty: how the gas I use anesthetizes. Despite decades of research, its mechanism of action remains a mystery. I must have faith in my anesthesia gas. It's an irony of our work that patients and their loved ones place faith in the anesthesiologist, who in turn places faith in the gas. In many ways, I'm a faith healer. I routinely ask patients to count backwards as the anesthesia medications are introduced. Counting backwards in this way is a time-honored anesthesiology tradition. When rapid-acting barbiturates were introduced half a century ago, making it possible to induce loss of consciousness in a matter of seconds, an anesthesiologist likely asked a patient to start at 100 and count back, curious to determine the speed of induction. 100, 99, 98. The practice stuck. In my experience, patients never make it out of the 90s. Chapter 1. A Deep Sleep. Amanda needed a deep sleep, a sleep like no other that she had experienced in her 5 years of life. Breathing was difficult, her nose always congested, but when she did sleep, she snored and her nose frequently ran. A clump of tissue with the consistency of jam, the adenoids, blocked the breathing path through her nose. Her surgeon needed to pass large instruments through her mouth, beyond her tongue, and past her tonsils to scrape or burn, the exact technique the surgeon's choice, the redundant adenoid tissue to open the path of air through her nose. The procedure required Amanda to remain still, open her mouth and keep it open, to let the surgeon pass surgical instruments deep into her mouth, to not cough or gag, and to not scream or cry when the knife sliced the adenoids out. To make all this possible, Amanda needed the deep sleep of anesthesia. Amanda knelt on the gurney, her toes peeking out from under her bottom. She leaned forward, elbows on the mattress, contentedly coloring the paper in front of her, unaware of what was to come. I don't think she even noticed me when I entered her pre-anesthesia space. Her parents, standing to the side of the gurney, appeared trapped in tight quarters, and couldn't disguise the fear on their faces. How would I place their daughter under the influence of my gas, and would it be safe? In the thousands of cases in my career, my anesthetic has never failed. It's 100% effective, I said. The look in their eyes changed slightly, but I didn't have their...
To keep listening to this audiobook, I've left you a link in the description so you can do it, at no cost thanks to Audible's 30-day free trial.